Hey, it's Dave Frank from Walden Dental with another episode of Tooth Talk, where we go through and we interview other healthcare providers, dentists, specialists in Austin to get to know not only those healthcare providers, but to get to know a little bit more about what your specific interests are. Today's guest we have is Dr. Brandon Johnson out of Brushy Creek. And Dr. Johnson, you are a general dentist. I know that you're not from Austin, but what brought you to Austin?
My wife is actually in the military, so my wife's a military dentist. She did a year residency in Columbia, South Carolina, got stationed at Fort Hood, so luckily she's been told that she gets to finish her military commitment out there. So we made Austin our home, and we bought a practice at Brushy Creek, and we're planning on staying here for the long run.
That's fantastic, and tell her thank you for her service.
Absolutely,
With me being in the military too, it's a great way to get started. And kind of going along with that line, what does it feel like to have a spouse at home that you can share stories about dentistry with?
It's a little nerdy, man. I mean, there's a lot of dental talk. We try and keep it relatively excluded to work in terms of what we talk about when we get home, but we'll run through cases with each other. We'll talk about stuff that we had difficulties with, so it's cool to be able to collaborate with your spouse and have her and both of us be on the same page with what we're doing on our day-to-day basis at work.
It's a huge help to have that, being able to not only share ideas, but also I can talk from my own personal experience, for someone to actually know the storyline, so that's not only do you have kind of your own little mentorship together there, some of the successes and sometimes the failures can come up to where it's, hey, how would I handle this a little bit differently?
Exactly.
And not having to ask the colleagues during the 8 to 5 time. And you two met in dental school, right? And
Yep.
you went to University of Pennsylvania.
Yes, sir. Yes, sir. We went to UPenn together. We met our first year. She wanted nothing to do with me when we first met. I think I had a little bit of the stash going on at the time, but persistency is key. She eventually gave me a shot, but we've been dating since our first year of dental school.
Awesome. So with the type of dentistry that you're doing in Northwest Austin, tell me a little bit more about some of the real passions that you have with the dental services that you're providing, and really what do you see the calling for patients asking for up here?
For us, it's really important to focus on accessibility. We take all major PPO insurances. We were really trying to build a family community practice. The other thing that's really important to us is just being able to communicate with patients outside of the traditional phone lines where they have to call the office between our working hours. We have software where patients can text us. I do a lot of virtual consults on Facebook where patients can just message me and I can get a picture of what might be going on and kind of answer questions just right over the internet. Obviously, it's not a diagnosis because we need to do an exam and x-rays, but being able just to get a picture from a patient, sometimes you don't need to take time off work and come in, take time out of your day to come ask the dentist a question. If we can just do it virtually right over social media, it's really convenient for folks. The other thing with accessibility, we're doing free emergency exams for people.
Okay.
Yeah.
So we need to take some of those statements, because you said a lot of important things right there. And based on what I think folks' traditional conception of dental practice is, if I can't call between the times of like 9 to 4, don't call during lunch because no one's going to answer. Wednesdays and Fridays, the dentist's office is oftentimes closed.
Exactly.
You totally opened up the accessibility of patient communication. And I can speak on that as well, from the element of the time people are thinking about their dentist or a dentist. Is it about 12:30 a.m. to 2 a.m. because they can't fall asleep during a toothache? Walk me through some of these steps about some of the means to communicate. You were talking about text. Tell me a little bit more from there about what you guys are doing.
So we have a software called Weave where patients can text our office and I can communicate remotely just from my house. I have accessibility on my cell phone.
Okay.
We also do a lot of virtual consults through Facebook like I was talking about. I've had people text me at midnight saying my tooth is killing me, what can you do? I can get on my phone and say, send me a photo, I'll get you in at this time. We can open up early to see them. So
Wow.
just being able to, it's almost like having 24/7 access to a provider just to
Yeah.
be in contact with. We're really trying to just be there for people, even though our hours are 8 to 5 on a given day. I don't want to just cut people out who might be in pain
I mean, that's,
after those hours.
that's totally game changing. I mean, and frankly, from what I'm hearing on there, like if you can have your own accessibility, because toothaches usually come at the worst time possible. Murphy's Law and dentistry go hand in hand.
Yeah.
You're usually on a business trip. You're usually like getting ready for a wedding, or you're on a vacation you've been planning for the last 4 years, and you may not even have service because you may be out of the country. And time zones have changed. So someone has the ability to not only communicate with the dental office, but now you're saying that they can communicate with the dentist themselves. I mean, that is high speed stuff. I got one last question, but before I ask, where can people find you? How do they get in touch with you? What is the office communication, and what number do they use in order to get in contact with you if they are going through this, and if they are watching this at 2 a.m.?
You can text or call us at 512-580-9200. We got Facebook, we have Instagram at Brushy Creek Dentistry. You can check us out just with the Google search, Brushy Creek Dentistry. We're in North Austin, so yeah.
With all of the things in the past that was dealing with the difficulty of being able to see a dentist, not being able to be having their scheduled preventive care, a lot of folks were due for their 6-month or 3-month cleaning, or maybe knew that they had some dental treatment that they wanted to get accomplished, and it had to be postponed. What's the single best thing that someone can do at home right now if they're not ready to see the dentist to keep themselves as healthy and away from pain as much as possible?
I'd say just get on the schedule. Give the office a call, whoever your provider may be, and get on the schedule for once we're in the clear with this coronavirus scare. The other thing too is you can shoot me a message or FaceTime video call me, and we can, if you have a question that you're concerned with, it doesn't cost you anything to get in contact with me. I can try and take a look over the phone, and we can determine, hey, this is something serious where you should get in sooner rather than later, or this is something that we can wait on, and we'll address it once we're allowed to safely see patients again.
So bottom line, and I heard this quote recently, and I really like it. It seems like for dentistry now, it's not about us promoting vain dentistry, it's about sane dentistry. And how do we move along with this, with a lot of the changes that have happened recently in America with COVID-19 and the economic impacts on that. Thank you so much for coming. Again, this is Dr. Brandon Johnson out of Brushy Creek, exceptional dentist, young, hungry, and making it available for folks that don't otherwise have a dentist or have had those barriers in the past that made dentistry seem like it didn't fit for them. I hope you enjoyed watching this with more to come. Take care, live well, and smile.